Hello, guys, and welcome back to the podcast. I'm your host, Dr. H, and today on the World's Okayest Physical Therapy podcast, we're taking a look at the quintessential outpatient ortho physical therapy clinic. But first, please don't forget to like, comment, subscribe, and leave a review of the podcast as it helps immensely with the algorithm. And make sure it's a fair review. If you feel like I should be talking more about something or less about something, that's the only way I'm going to get better at this, because I'm learning to navigate this healthcare environment too, this Byzantine system that we have, this Byzantine labyrinth of the American medical healthcare scape, if you will. So, again, let me know in the comments and stuff what you want me to talk about next and any questions that you may have. But today, we're taking a look at the quintessential, stereotypical outpatient ortho um, clinic, physical therapy clinic, and the different roles of the people that are in there. And first, we're going to start with the physical therapist. So I've talked about the physical therapist quite a bit. Um, they are a doctor of physical therapy, usually, and they are the ones that are in charge of evaluating the patient. They're in charge of diagnosing movement issues or impairments, and then creating treatment plans in order to help address those things. So, for example, what does that look like? You come in with shoulder pain, and the physical therapist says you have a range of motion impairment where you are 20 degrees less on your right than you are on your left, and you have a mobility issue or strength issue where you're way weaker on this side than that. So, these two things together are driving your inability to reach overhead. And I think you should come into the clinic 2 times a week for 8 weeks. Bada bing, bada boom. You got evaluated, you got diagnosed with a movement issue, and you also have a treatment plan. So, what's going to happen next? Well, the physical therapist is going to be doing manual therapy, exercises, stretching, and educating the patient in order to help them get better. And what ends up happening, so that's what's up happening, what ends up happening legally is the physical therapist is the only one that can document those active range of motion and strength deficits and diagnose you with a movement disorder. Okay, so they're the only ones that get to document it as I did the evaluation and I found this. This also leads to them being the only ones that can make clinical decisions, because they're the only ones that can make the clinical decisions based off the impairments that they saw. And it's one of the things that a physical therapist goes to school to do. And the other thing that they can do is outcome measures, which is another way to track your progress. If you've ever been to a physical therapy clinic and they say, can you please rate your satisfaction today? Do you feel like you could do this better, that better, this better, that better, blah, 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 blah. Please rate yourself on a scale of 0 to 5 for the following exercises or activities. That's an outcome measure. And as we talked about earlier, physical therapists can specialize in a whole bunch of different things. Now, a really easy way to think of a physical therapist in the setting of the clinic is either the strategist, the architect, the person who explains the goal and the design of something and then leaves the actual building and the intent of it up to someone else. So an architect is a pretty good metaphor. A strategist is also a pretty good metaphor. They may be the one who has the plan, but it's up to someone else in some clinics to accomplish that task. In a one-on-one clinic, it's usually a physical therapist who evaluates you and then also treats you every time that you're in. But again, the stereotypical quintessential outpatient ortho clinic, it's going to be a physical therapist who evaluates you, and then it's going to be the next person, the physical therapy assistant, the PTA, who actually does a lot of the treatment. So the PTA, by contrast to the physical therapist, is someone who has a licensed provider, and they have at least an associate's degree. A lot of times it's more than an associate's degree, but it's at least associate's degree. And they're the ones that are responsible for implementing the PT's, the physical therapist's plan of care. So if you're supposed to come in 2 times a week and the physical therapist has highlighted that they need to have right shoulder strengthening and stretching, the physical therapy assistant is bound by that. And what they'll do is they'll be the ones that do the exercises and the stretches with the patient. And they're with them the entire time for the treatment session. What they cannot do is they cannot evaluate. They cannot go in and measure and say, oh, wow, look, your shoulder has improved by 5 degrees this session. Nope, not allowed to do that. And they are not allowed to change the treatment plan. So the physical therapist said you need to come in one time a week. They cannot say you should be coming in 2 times a week. And if you're coming 2 times a week, they cannot say you should only come 1 time a week. That's beyond their scope. And what they do, though, is they work very closely with the PT to accomplish the physical therapist's intent for the patient. A really good parallel to this is if anybody was in the military, is an officer, a commissioned officer to a non-commissioned officer role. An officer in the military, a lieutenant, captain, major, lieutenant colonel, whatever, they are a commissioned officer by the President of the United States. That's who they receive their commission from. A non-commissioned officer, an NCO, is a sergeant. And what happens is an officer, a lieutenant, captain, major, will give a sergeant their intent. They will say, hey, my intent is that the floor will be cleaned by 1 p.m. today. I don't care how you get it done. I'm leaving the details to you, but I expect this floor to be cleaned by 1 p.m. And then the officer goes back to their office and they sit down and they do whatever paperwork or teleconference meetings or whatever it is that they have to do. The sergeant then looks around and says, okay, I have 10 people at my disposal. I want 5 of you to mop, 5 of you to sweep, and then once you're done, the sweepers are done sweeping, I want them to take out the trash, and once the moppers are done mopping, I want 3 of you to go and get the wax machine. That's the sort of minute details that be left up to the sergeant. And then when the officer comes back at 1 o'clock and looks around and goes, wow, you really did clean the floor. Good job. All right, everybody go home. We're going home early today. The only thing we needed to do today got accomplished. That's how the physical therapist and the physical therapist assistant is supposed to work. The PT comes and says, here's the intent, strengthen the shoulders, specifically this, and this, and then make sure you stretch it because they have a range of motion limitation. And then he goes back to his office because the physical therapist is on to another evaluation or reevaluation or whatever else. And the PTA is the one that is accomplishing that task. If anything comes up, the PTA will usually say, hey, let me go talk to the PT. I have a question about this, that, or the other. And they'll run off and have a little mini conference with the PT in order to discuss any sort of changes or additional exercises or stuff that the PTA might want to add. And this is where it's really important. The PTAs, just like a sergeant in the Army, not exactly, right? We're not saying it's the same thing, but just like a sergeant in the Army, they might have their particular favorite exercises or stretches or whatever, interventions that they think works best for whatever condition is that they see. And this is where I want to park out for a minute, because a physical therapy assistant, especially if they've been doing this for a while, is typically pretty knowledgeable at things to help you get better. And a lot of times patients will step right over the PTA and say, you don't know anything, you're not a doctor, you couldn't possibly help me. I'm going to go straight to the doctor of physical therapy because only they are knowledgeable. And it is true, like we just talked about, the PTA is limited in their scope of care. They cannot change your plan of care, they cannot change your treatment plan, and they cannot evaluate you. But they can definitely provide you insight and experience, usually personal experience, of what they're seeing and how you can get more out of whatever intervention is that you are doing. It's just, it's a little bit, what's the right word? It's a little bit disrespectful to look at PT in the eye and tell them that you discount everything they say because they don't have the degree. It's less about the degree and more about the roles and responsibilities. It's one thing if you look at the PTA and say, hey, I know this isn't your scope, but I have a question. And the PTA goes, oh, yeah, no, I can't really answer that because that's not my lane, but that's the PT's lane. Let's go ask them together. Versus you don't know what you're talking about because you don't know anything. That's not really a fair assessment of a PTA. They know a lot, and if I had $1 for every time they were mistreated, I would be very rich. So all to be said, don't treat the PTAs poorly if you're working with them. They typically are very knowledgeable. It's just that their scope is limited. They can't answer a lot of your questions as a patient, not because they don't necessarily know and not because they don't have an opinion, but because they're limited in what they're allowed to say. And it falls more into the PT scope to answer those questions. So just because they don't answer you doesn't mean that they don't know. It's usually more of a little bit of a restriction sort of thing because they're not allowed to say exactly what they think, just like a PT is not allowed to contradict a DO or an MD. If you walk in with a diagnosis of shoulder impingement, The PT can't necessarily say, no, you don't have that. Absolutely not. You do not have that. I'm undiagnosing you with this. The PT can say, hey, yep, that is the diagnosis that you're given to by the doctor, but I do think something else is going on, and this could be a driver of that pain as well. And what we're going to do is just strengthen and stretch and see if that gets better in 8 weeks. That right there is where you have the PT saying it's outside of my lane to undiagnose you. We cannot diagnose you with conditions. I cannot say that you have specific things. I can only say you have movement disorders, like impaired range of motion and strength. So the same thing is true for a PTA and a PT. The PTA cannot say specific things. They cannot evaluate you. They cannot say, yeah, you definitely have changed your range of motion. It's 180 today and it was 170 last time. They're not allowed to do that. So all to say, understand they have a role, understand they have a lane, but just make sure you treat them with respect, because I've seen them get absolutely treated with disrespect, and it's not good. They deserve more respect than that. The rehab aide. Now, this is someone who is not a licensed support staff. So they don't have a license and they don't have a degree. Well, they can have one, but they don't need to have one. But they're basically in charge of setting up exercises, setting up equipment, cleaning equipment, and guiding patients between stations. They can help demonstrate some things, and in some cases, they can supervise really low-risk activities, but only under the direction of a physical therapist or physical therapy assistant. They are not doing anything on their own. They are always under direction and supervision. Effectively, if you're wondering why they exist in the ecosystem of the clinic, it's because it's a way to get students and anybody really who wants to a foot in the door of a clinic. It allows them to get in, to see how it operates, to understand the different roles and responsibilities, to get observation hours, and to work while maybe they're studying for some sort of certification. And basically, it keeps them in the system, gets them what they need to further progress themselves. This is very much a position where it's, hey, I'm here to do the work, but I'm also getting something out of it. And I'm going to forward myself in my career, so I'm not going to be here in this role forever. This is definitely I'm stepping up the rung of the ladder to get to the next step here. A lot of times, the rehab aides are interested in becoming PTAs, for example, or PTs. Very, very common. But that's why they exist. But a good way to think of them is they're the ones in the background making sure everything runs smooth, that you have pillowcases, that you have towels because they're doing the laundry, and they're making everything clean and sanitized. Next, you have the front desk, which is usually the first and the last person that the patient sees. And they are critically important because what they do is they handle scheduling, insurance verification, copay collections, and so on and so forth. It's the front desk that's usually telling the physical therapists, hey, we're coming up on a dry spell here. We don't have that many evaluations coming in. Or, hey, we're completely swamped. We have way too many evaluations coming up. We don't have enough slots to get people in. They're also the ones that are usually pretty good at catching what the patient is feeling at the end of the session. If they're super tired, if they're super sore, if the patient felt like they were pushed too hard or not pushed enough, if they're hurting from something that the physical therapist or physical therapy assistant had them do. The front desk is phenomenal at catching those things and usually relaying that information. So that's who the front desk is. Absolutely critical for a good running clinic is a front desk. They make life easier, especially when it comes to scheduling and helping manage the flow of the clinic and making sure there's a steady income of new patients and referrals, and then making sure everybody gets seen in a timely manner. It also really helps with insurance verification, because nothing's worse than being a patient thinking you're going to come in and not have a copay, and you find out that your insurance isn't covered and now you owe several $100s. That's really rough. And a good front desk that says, hey, we actually can't see you. We're calling you 2 days before your appointment to let you know that we don't accept your insurance, and we thought that we did, but we don't. And so you'd have to pay out of pocket if you come here, and you probably don't want to do that. Yeah, it's really, really helpful instead of having the patient show up that same day and then get told that and then get very frustrated. So front desk is critical. And again, in a group of unsung heroes, the front desk deserves to be sung about. They deserve to be, what's the word? Lauded? Yes, we're gonna write that. They deserve respect. And then last, we have the clinic director and or the lead PT. Now, this is a physical therapist who is wearing 3 different hats. The physical therapy hat, a manager hat, and the mentor, typically. Their job is to manage the administrative side of things and the clinical side of things. They are maintaining a caseload, they are continuing to see patients, but they are also very busy running the administrative side of things, ordering whatever it is that the clinic needs, whether it be equipment or needles or gauze or towels or whatever. They're responsible for trying to help the physical therapists underneath them decide what schools to go to, what certifications to get. They are responsible for a lot of times hiring um, and so on and so forth. So they're very, very busy being an admin, and they're also very, very busy being a clinician and treating patients. And then finally, they're also, like I said, the managers. So they're helping the front desk and the physical therapists and the aides. And then even if they may have some sort of like monthly meeting or quarterly meeting where they have to go as the site director and go talk to the regional directors about whatever their site is doing. So whatever metric they're not hitting, um, whatever metric they're not hitting or whatever they are doing exceptionally well, what the key to their success is. Why do they have a 99% satisfaction score, for example? Very, very, very big shoes to fill. And not, again, to forget that they're mentoring. So a lot of times they're making time at least once a week to sit down with some of their PTs and mentor them and show them the ropes of what to do and how they got to this position and whatever their specialty is. A lot of times clinic directors are specialists in something, whether it be foot and ankle, shoulder, spine, whatever. A lot of times these folks are very well seasoned and they know a lot of what they're talking about, and that makes them very, very valuable. Um, if you want to think about this, they are kind of like the captain of the ship. They're the one that's like overseeing everything and trying to make sure everything is running. And above them, of course, you would have regional managers and then so on and so forth up the chain. And then, of course, your relationship is only your relationship. Your responsibilities are only going to grow the further up the ladder you go. And to again speak about these guys a little bit, a lot of the times when you reach this level in your career, as when you're doing admin and clinical work, you kind of have the patients that always come back to see you. So a lot of the times these clinic directors are either taking advanced cases that are very difficult, that they either know that they specialize in, or they aren't sure that the more junior PTs are ready for, or they're just more confident they can have a better outcome than the junior PTs. And that's where the balance of mentorship comes in, right? You're not going to set up your junior PTs to fail, but you're also not going to hide them away forever and never challenge them. And that's where the the clinic director's skill really comes in. But a lot of times they're going to take on really difficult patients, and they're also going to have their old clientele, the patients that will only see them because they don't want to see anybody else, because they have that one guy that when they hurt their back golfing 20 years ago, he was the PT that helped them get better. And that just seems to be a fact of physical therapy clinics. Everywhere you have your what we call your lifers, the patient that knows you now and trusts you and is going to be there for life. And that's a hard thing to juggle in a director's schedule, right? If you have a returning patient, they say, I need to only see this person. What is their availability? And it's very, very limited, right? That's where it can get kind of difficult to see a clinic director. So if you are one of those people that has a guy who's a clinic director and you don't understand why it's so hard for you to get in there, it's because of all the admin stuff. It's because of the other patients that they have that are like either very advanced or have multiple things going on, and or the mentorship and everything else. So when usually you call a clinic and it says, oh man, they're booked solid for 2 weeks, as I currently am, it's not a lie. You are usually absolutely booked for 2 weeks, just because of how things kind of shake up. So other honorable mentions for roles: billing specialists. They're the ones that, of course, handle all the insurance claims and payments and such. Student interns that show up and they monitor, and sometimes they clean too. And then the marketing liaisons and community outreach folks. But really, that's typically physical therapists themselves nowadays. That's where they go out and they do events. So they'll be at a running event like a 5K or a 10K or a marathon, you have PTs there on the side with a little booth, and they'll say, like, blah, 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 physical therapy, here to help you get better. Get a free ankle evaluation or whatever. And that's sort of like marketing liaison and community outreach that physical therapists now do as well. So a lot of this, physical therapists have started doing their own. Now, by contrast, just real quick, my clinic does not have physical therapy assistants, and it doesn't have rehab aid. We only have physical therapists and then a clinical director, as well as the front desk. We don't have PTAs and physical therapy rehab aides or techs. So in our clinic, it's a little bit different because we treat our patients one-on-one all the time. So we are the ones that have a pretty good idea of exactly what exercise or intervention or stretch we want them to do. So there are different models within physical therapy. And the one that I outlined, that is not my clinic, but it's the one I outlined here, is a very stereotypical and quintessential clinic. But you can see already, like I just said, I don't have two of those people, two of those different roles in my clinic, and we still operate smoothly. We just, as physical therapists, do more. And that's some things that different companies with their models kind of go after. Some are like, hey, we're going to get you in, we're going to get you taken care of, but you're going to be seen by a physical therapist only for the evaluation and the reevaluation, but you're going to be working with our PTAs, our physical therapy assistants, every time else. Or you have businesses that come out and market themselves and say, hey, you're going to get seen by a physical therapist every single visit. Right? So different models, and there's a whole bunch of different reasons why, which I'm not going to break down in this podcast because my intent was only to educate you and myself on the different roles that there are in a stereotypical, quintessential outpatient ortho physical therapy clinic. So thank you so much for watching or listening. Please don't forget to like, comment, subscribe, and leave a review, as it really helps. And share this with everyone you know if you think it was quality, because I'm out here on a mission to educate everyone that I can. And I'm going to keep making podcasts, whether you give them a review or a like or a listen or not. So everybody stay healthy, stay fit, and stay awesome. And I will catch you all in the next podcast.